Imagine living in a rural community where it may take you 2 hours on foot to access healthcare in another village, even in an emergency. It may seem unbelievable for residents living in urban centers, but true for inhabitants of Mafi-Adagbo in the Central Tongue District of the Volta region. It was 6 a.m. on Saturday, October 16, 2013, at a village called Mafi-Adagbo in the Central Tongue District of the Volta region. Mama Ajo, we were told, has arthritis. This means her joints are inflamed. But her condition demanded immediate medical attention. Meanwhile, Gifty, who was down with malaria last week, is ill again. We found out Gifty and Mama Ajo could not go to the nearest health center, which was 4 kilometers away, because there were no vehicles available in the village. The only means of transport in the village is the use of motorbikes. However, at the time of our visit, none was available. Neighbors were only waiting and relying on the benevolence of young men in the village to send them to the health center. After an hour, some young men volunteered to carry the elderly woman, Mama Ajo, to the hospital. Without a stretcher and an ambulance, they had no option than to invent one. Then, the 4-kilometer walk to the nearest health center began on foot, with Gifty and her mother tagging along. But just after 5 minutes, the young men were tired and had to take a break. After 10 minutes of rest, they continued the walk again. 1 hour had passed and were still not at the hospital. One could only hope and pray that Mama Ajo's condition will not deteriorate. After 2 hours, 11 breaks, we finally arrived at the health center. A journey which could have taken about 15 minutes by road had to be done in 2 hours. For many poor people in rural Ghana, accessing healthcare is a major challenge. Dozens of inhabitants in poor farming communities have died needless deaths as a result of snake bites and in the process of childbirth, just because they could not make it in time to a health facility. It begs to say that until a remarkable improvement is made in accessing healthcare, rural farming communities will continue to gamble with their health.
Access to healthcare is a basic human right, and it is the responsibility of the people that we have put in position to provide that healthcare to us.
This problem of access to healthcare is common in most farming communities in Ghana, and northern Ghana is not an exception.
Residents of Yemo Karega in the Karega district of the northern region are celebrating their annual Yam Festival. However, as cheerful as they look, they have challenges with accessing healthcare. Their concerns with healthcare are shared by many rural farming communities in the 3 northern regions.
As women farmers in this community, there are a lot of problems facing us here. And some of them are the access to market, access to credit, and access to extension services. Another problem facing us is access to health care.
Maya, the Buto Kana. Jaha, to me, no papier of Pumpoma, Bracana to Mate, Kahafe Shores Wakana. Then I come on, Catazan let into my Dempulumuna, Tenanye, Suchis in the Polo. Yet almost Radunculamos, the Zanya, the Nessin Ma. But to my less Hashele, Kachang Yung. Can you know to Tumtumama ha le cartogum? To Rungumama or Kutu or Bay could do not any salma or dwane. Yes, a man non latum. Then to Maya to Amusar la Shambala.
When we go to hospital, the health workers they don't have any respect for us because we are farmers. Sometimes they will jump the queue, calling people from the back to enter into the consulting room and other places, whereby we will spend a lot of time. Sometimes of the whole day, you will be in the hospital, you will not get treatment. Sometimes you will not even see the doctors.
I am a blind man. When we go to the hospital, the nurse look at us. You know, we can't see. They'll get some people's card and then go and then treat them. As we, the blind people, I'll just sit down quietly like that. Nobody will come and tell me that. Come in and then they will treat me. So because of that, I was annoyed. And then if you tell the nurses what they are doing is not good, they start to insult you. That you are a blind man, how do you know that we are doing this and that?
When they are sick and they come to the facility and they go to the maybe a health worker to attend to them, sometimes he will tell them that, oh, he's busy or he's having 1-2 to do. So the client should wait at the facility for them to come. Sometimes because they are not having the health insurance, they don't always pay much attention on them.
2013, I went to give birth. So when the nurses asked me that, why do you delay like that? And I say, oh, I did not delay. So when I was there talking, they start insulting me. After they insulted, and I say, why are you insulting me like that? And they start just beating me.
Because of that, it drives us away from going to the hospital because we are farmers. Sometimes we'll go to the drugstore to get medicine from those pharmacies and come and give the treatment to ourselves and our children. Sometimes to go to the herbalist just because of the way the nurses are treating us.
So bentuk po aship tumani wo don piamma yanga wo detama piamma bato tebo wo barga won barga ban te zongo para aship tum ma gba won barga ma yama lan kan bakulan to nyang duroma dentama ay nyam kan yaflima karayi.
It is up to the Ghana Health Service to enforce their rules and ensure that health personnel who are not adhering to their own Patients' Right Charter are brought to book. I think civil society groups should begin to educate the farmers properly. The health facilities should also understand that when these farmers come, irrespective of the fact that they are from villages or whatever ought to be done if they are in Accra ought to be given them, at least to the level that the facility can provide.
Most of them are illiterate, because of which they wouldn't be able to know as and when their card is expired, because of which they may be seated at home with expired cards, only for them to get to the hospital when they are sick and they will be told in their face that their card is expired. It poses a lot of inconvenience. Secondly, they don't see the need to even come to renew their cards while awaiting a possible sickness. They will have to wait until they are sick before they rush to the hospital. Granted that it is weekend, meaning they would not be attended to by the NHI officials because Saturday, Sunday we don't work or public holidays.
It is during the work we do with our members at the grassroots and what we have observed and heard that we thought that it was incumbent on us to do something about our members at the grassroots accessing quality health care.
So peasant farmers working with most rural farming community, we decided to take northern Ghana as a pilot community to address this problem. So we started in September last year by conducting a baseline survey to actually know the exact situation on the ground.
Geographical access, it's a very serious problem. That comes with infrastructure, and that also comes with transportation,
which is affecting their productivity. So we did a deba where the farmers came up in their numbers to match in Gusegu Karga, Yamu Karga, and then Zinido in the northern region to sensitize their colleagues about the issue. In the Upper East region, we did similar roadmap in Garu Timpani district involving the chiefs and other key stakeholders in healthcare delivery.
The Peasant Farmers Association of Ghana, we wish to present our petition to the Tumukuru and his traditional
With this similar thing in Sisala East District, that is in Tumu, we brought health service providers together with the farmers to talk so that they will bring out the issues and for them to actually come to an agreement as to how healthcare should be delivered to farmers.
I will say it is successful because we have been able to engage all stakeholders in the value chain of healthcare. We were able to meet the chief of the area. We came together, and so farmers have now known their rules, and their responsibilities, and they also knew their right.
Our women over here used to shy away from the hospital because they think that they are dirty, and when they get to the hospital, they are treated anyhow. But when they started educating them and telling them that even no matter how dirty they are, they still have a right to health.
Thanks to Peasant Farmers Association for organizing a program which brought the farmers and then the health workers together, and we laid our problems to them. They talked to the health workers and they really understood us and made a promise to change, and it has actually worked for us. They have totally changed and improved upon their work. Now when we go to the hospital, they get enough time for us. They respect us, smile at us wherever we go. Their attitude has totally changed from those days.
Now, when I go to hospital, I receive better treatment from the health workers.
Because of the good news I have heard from my friends, I will now go to the hospital because I have heard that they have changed. So I'm happy to go to the hospital.
To kapti yina zang bamang chante ti ngjonde health insurance tuma duzukma kabeda yina pam nti nang mahte health insurance to benda mahte health insurance ma cha ti panye ye to muksrama pibu dama ai chang ashibtma na health insurance ma bi kullah gbagba ka kuya no nang bana ndo ko zon cha anyer la tabrosum dana.
Peasant Farmers Association has made an appeal. They actually called on us to register their members. Haven't taken notice of the fact that health is very paramount to their work. So we organized a deba in Zinindu, which is a farming community, the second largest community in the district, Gushego district. So the entire registration, we were able to record close to 3,000 peasant farmers, which were brought on board as new registrations. And then about 500 fresh renewals were also recorded. So as a result, if one is to evaluate, you would realize that it's really yielded a very positive result.
Quickly, the intervention that we put in place was to address the issue of attitude and thereby organizing a customer care for all our health staff. What we also did was to train them on the patient charter. And then there was also an issue of access. There were no health facilities within this catchment area. Now we are constructing 9 chips compounds. The assembly is bringing 3 on board, and the issue of access will be improved completely.
Health is one of the key thematic areas that Star Ghana is funding, and so this was a key area for us in the sense that we're looking at people who were vulnerable in the sense that they live in rural communities and also far from the health centers, and the way they were treated. So for Star Ghana is key because we are looking at vulnerable groups and people who also are in deprived areas of our country. We are expecting that by the end of the period, they have run a 2-year project. By the end of the period, they would have created enough awareness amongst the rural communities and farmers, and also among the health service providers.
Star Ghana has supported a lot for us to run this program.
A lot of our members in the regions, especially where we have undertaken these campaigns, their eyes are now opened as to where are you going to renew your card in terms of the days, when are you supposed to go to, how are you supposed to go to hospital.
We would have loved very much to share our experiences and the lessons that we have learned with so many communities, not only in the northern sector of Ghana.
We would like to thank Star Ghana for this support. It has actually yielded a result that we think that if most donors are actually tuned their concentration to, it will lead to reduction of poverty in Ghana.